Okay, Tam Scorpio, I'm so glad that you have a question. I know someone who has had bariatric surgery. With good advice would you give them? Depending upon when they had it, one and what type of bariatric surgery. There are several types. There's the total and complete gastric bypass, which reroutes all of your plumbing. There's the gastric sleeve. The gastric sleeve basically takes your stomach, which for most people at that point in life, the stomach is swollen to about the size of a 2 liter Coke bottle, about the size of a 2 liter bottle. Envision that. They take it and fold it upon itself until the actual space and surface area of the stomach is about the size of a banana. So you have less surface area to absorb calories, and you have a sense of satiety. You feel full quicker. So that is how that works, and it works wonderfully. They call this either the sleeve or the gastric bypass the surgical cure for diabetes, because there have been cases of people that were very difficult to control diabetics. They got this surgery, and by the third day, they were off their insulins because of other neurohormonal function between the stomach and the pancreas that are fixed, blocked, or corrected by this surgery. And so, people that are diabetic, not only now do they not have the diabetes, but they start to lose dramatic amounts of weight. The problem with that is that the gastric tissue is living and breathing tissue. So they chop it down to, they fold it down. It's not chopped, it's not cut with a gastric sleeve. With a gastric bypass, they chop it down to about the size of a plum. But if you keep eating, you can stretch that small space out, and eventually they can become the size of a 2 liter Coke bottle again. That's when you see people that get the surgery, they lose 100 pounds, 120 pounds, but 2 years later, they're back up to where they were. That is very damaging to the body in a variety of different ways. The simple things is it stretches your skin. Now you have skin folds, skin flaps, and you're susceptible to skin infections, which most of the time are just a bother, but actually can become a problem, make you septic, and create other issues. But the stress on your bones, the stress on your GI tract, all those things result in poor health. And so your risk of your cardiovascular risk factors increase exponentially if you lose weight and then gain it back. So I tell people all the time, my objective with the LipoLine weight loss plans is not to see how much weight we can get off you in 3 to 6 months, because we can get almost any amount of weight off of almost anybody in that short period of time. If they do everything we ask them to do, they'll lose weight. It happens. The problem is where you're going to be 6 months after that. We want you to sustain the weight loss. That is the benefit of altering your metabolism. So calorie restriction works, but it won't keep working. And most people start eating around it because they just start to crave foods. I tell everybody there's a hormone in your body called ghrelin. Ghrelin the gremlin, I call it, because ghrelin tells you that you're not full to keep eating. And when you start to lose weight, the level of that hormone in your body keeps going up and keeps going up and keeps going up until eventually you can't resist it anymore. It is not you having poor intestinal fortitude, or you can't stick to anything. That ghrelin literally makes you eat, and it tries to make you eat to get back to whatever your starting weight was. The problem is you get back to, you lost 20 pounds, you gain back 30, because it doesn't stop once you're at 20 pounds. It takes a while for it to come back down and get back to where you were. So most people will gain more than they lost originally. That's why it's very important to have a maintenance plan in your diet so you can keep doing that. So one, they have to make sure, a person with bariatric surgery, that they're getting all the vitamin supplements, because they lose the ability to metabolize and absorb B12. So B12 deficiency is very frequent in patients with bariatric surgery. They have to be careful about taking anti-inflammatories because they can irritate that small space. They're not digested as quickly. You can't put a lot of fluid in there to dissolve the tablets. So the tablets sit on the stomach lining and basically just burn and irritate it like an acid, and it can give you stomach ulcerations and cause even a GI bleed. So those are the things to be avoided. Make sure you're taking a complete multiple vitamin with iron and minerals, because you cannot absorb all of your iron and B12 supplementation separately. Ideally, a sublingual B12 under your tongue, just like the Lipodrops, which will help you maintain your normal vitamin levels. Great question.